Hi everyone, this is Jason Barrick of Wall Street for Main Street. Welcome back to another Wall Street for Main Street podcast interview. Today's special guest is a first-time guest. He is a physician and scientist, and he's also the author of Assume the Physician. He's also, you may know him as the co-author of Speculator, the first book in the High Ground series, and the newest book, Drug Lord. His expertise is in the medical care financial systems. Dr. John Hunt, thank you for joining me.
Hey, thank you for having me, Jason.
Now, John, I just finished Drug Lord. It's available on audiobook on Audible now, too, as well, besides the normal ways to read a book. And you and Doug, I think, besides making a very excellent fictional story, you put a lot of truth into Drug Lord about the problems with the healthcare system, the problems with the FDA. Why did you choose to go the fiction route?
Well, you can do things in fiction that you can't do in nonfiction. You can pull in more emotional contact. You can get the reader to basically personalize the good guys and be antagonistic towards the bad guys, so that they get more ensconced in the concepts. They can feel like they're living it. And I think that's the main purpose. It's not a dissertation, but rather hopefully a fun adventure story that is highly enlightening at the same time because people get involved.
Yeah, I would agree. That's the way the book turned out. I also enjoyed Speculator as well. I thought that was entertaining as well. But I was talking with you before we started recording. My dad is a retired orthopedic surgeon, so I've heard him complain basically my entire life about the problems with the healthcare system. My dad tried to patent a piece of medical equipment and get approved by the FDA. They didn't approve it. My dad lost quite a bit of money on this investment, trying to be a startup entrepreneur. And the FDA has blocked, either they've allowed, large, dangerous pharmaceutical drugs to go through, or they've blocked potentially helpful drugs. And then the other thing that really annoys me with the FDA is what they've done with generics. And that's something that you cover a lot in the fictional book, Drug Lord.
Yeah, I mean, the FDA, it supervises something like 18% of the economy in one way or another. It's got its fingers deep in it, alongside this wonderful law called HIPAA, which is the Health Insurance Portability and Accountability Act, which was put through ages ago. Nobody paid attention to it, and now all the hospitals pay attention to it, but I don't think the government does. There's a whole lot of fear about FDA and fear about HIPAA, and the fear from FDA is justified. They are tyrannical in their control. They take essentially ownership of drugs that they approve, and therefore they're very selective on what they approve. It's incredibly expensive to get things through FDA. It's very, very time consuming. It uses up human lives to accomplish getting through the quagmire of the regulatory system, and it pretty much minimizes the ability of smaller investors and smaller entrepreneurs to have a shot at bringing something valuable into the market. It is entirely anti-free market. It is entirely fascist, and it's a huge part of the medical system. So what can we do to stop this raging leviathan that has gotten totally out of control? I see nowhere in the Constitution that it is justified to exist, and yet it keeps on growing and having more power. Americans have to stop this thing.
And I see the Democrats wanting to give the FDA even more power, and they want the government to have even more control over the healthcare system with single payer. But I've been a speculator in small biotechnology companies, and this didn't affect the company I invested in directly. But I saw one of these competitors. I saw the FDA, but almost all the people on these FDA drug approval panels. Not only are a lot of the people in the FDA bureaucrats, but a lot of the people on the panels are from the larger big pharmaceutical companies. So I've seen them, kill basically the trial of a drug, get it knocked down. The stock of this tiny little biotech stock dropped from a couple dollars a share down to pennies. And then I saw one only a couple weeks later, one of these larger big pharmaceutical companies. I think obviously this was planned and market manipulation, and because they use the FDA, no one can sue them or anything. I saw them go in and buy the patents and the pharmaceutical company out for literally pennies on the dollar.
Oh, sure. Yeah, there's a revolving door of pharmaceutical people going into the regulatory side, coming out, increasing their value to the pharmaceutical sector. It's the same thing in the government financial complex that we have in the FDA/government medical complex, medical device and pharmaceutical complex. there's people going in and out all the time, and they serve the needs of themselves. They don't serve the needs of people. Well, government pretty much never serves the needs of people, I think. So it's pretty ugly. And FDA itself, there's two components of it. Originally, it was founded to improve safety profiles of medications. People were submitting poisons into people's bodies. And then in the early 60s, it transitioned to taking on the duties of assuring efficacy of medications, how well they work. So what beyond safety and had to prove efficacy at the government's conclusion of what is effective or not. And it started getting highly collectivized. As we're sitting there in the middle of fighting the Cold War against the socialists, you got the FDA who's looking at collective data, so-called evidence-based medicine, which is just a big giant groupthink for the most part. And using those kind of data to decide whether drugs are effective or not. Now, the problem with that is that they delay things. There was a huge decline in submissions for approval from FDA when this happened, and huge decrease in the number of approved drugs each year. That began with this new regulatory paradigm in '62, and the net calculations of the amount of lives they have saved with these efficacy, by requiring efficacy proof, is something on the order of 7,500 lives since the early 1960s have been saved by having these efficacy proofs. The delay in getting these drugs that were eventually approved, mind you, but the delay in that approval of so many years for these eventually approved drugs is estimated to have cost something like 4.5 million lives, which puts the FDA at the strange position of being powerfully motivated to ban themselves. And I wish they would.
Does it cost over $300 million now to go through the full approval and regulatory process of start a tiny little biotech company pushing a drug through all the way the trials and then finally to commercialization? Is it over $300 million now in FDA fees?
Oh, no, but I think you have to look at. I think some of those data show that the approved drugs end up paying over $300 million on average to get that approval. There's a whole lot that fall out during the process and never make it that far. But to get that drug approved, it's not $300 million in fees. It's research studies and bribing academic center professors to kind of prep the water. There's a huge amount that goes into marketing, pre-marketing these drugs even before they are approved in order to get the water flowing for when they do get approved, because at that point there's so little patent life left off them that they've got to sell them like crazy. So there's a huge amount of money. Most pharmaceutical companies, the large pharmaceutical companies, are mostly marketing powerhouses and regulatory organizations. They're not R&D companies. They get most of their R&D from the small folk who can't fight through the regulatory bureaucracy very well and invent this stuff. And certainly if the small people fight through the regulatory bureaucracy, they're just not in a position to market against these marketing powerhouses. So the pharmaceutical companies are giant marketing houses, and we just have to recognize that. And they're also very ensconced in all kinds of government manipulation. Some of them use all kinds of programs, like the EPA, for example, gets used by the drug companies to make sure that asthma inhalers are kept very, very expensive. So asthma inhalers are generally, $300, $250 in the United States. You can get them for $22 just about anywhere else in the world. But in the United States, because the EPA banned the chlorofluorocarbons, and then FDA has not allowed any other generic inhalers to come in to fight to replace these things. So the prices of these inhalers are still $250, $350.
I actually didn't know that. I'm actually prescribed on Advair, so that's affecting me directly. Yeah, it's extremely expensive to be prescribed those medications. Yeah. Do you think that's why a lot of these smaller biotech companies now, instead of trying to go through the FDA approval process first, now they're going to Canada, now they're going to India, now they're going to Europe and Australia first to go through the regulatory?
Oh, sure. Yeah, they go to some places that are a little bit easier to get the regulatory approval so they can start having some market traction elsewhere in the world. They don't get the benefit from the ridiculously and painfully high prices of the U.S. pharmaceutical market when they do that. So it's a business decision. But they're competing against people like GSK, the maker of your Advair. That GSK was the biggest lobbyist. They wrote letters over and over again and lobbied the EPA to ban the CFCs in their own inhalers. In their own inhalers, they were hugely banning their CFC, even though CFCs that come out of these inhalers are tiny and contribute almost nothing to the ozone depletion issue. But they were trying to get them banned, and why? Because these drugs were generic at that point, and they didn't want to keep them generic, and they had a replacement. Came in with this branded thing that they've been making money on ever since. So it's pretty ugly. And do people go overseas? Do pharmaceutical companies go overseas? Yes. Do patients go overseas to get their drugs from Canadian online pharmacies, which are hardly ever in Canada, by the way? They just use the name Canada because people trust it. But yeah, sure, people go. Smart people will get their drugs from these massive Indian pharmaceutical companies, which will give you the same stuff that the U.S. and British and French pharmaceutical companies do, but they'll give it to you for a tenth the price. You just have to break the law. Order them from overseas, which I'd highly recommend.
Well, John, it seems like the government keeps changing the rules. So, like, people who are trying to, people can't afford, a bunch of different medications that are $5,000 a year each. The economy is not doing that well. Most people can't afford that. So, people are, if they're going to be labeled criminals, but they're going to have to do it to survive. That's something you talked about in the book at the very beginning there with Charles Knight bringing, just perfectly good medication that's generic into the United States. So he becomes a drug dealer, but, not the normal drug dealer that we think of when we think of drug dealer.
Right. No, he's dealing illegal drugs. Absolutely dealing illegal drugs. Just illegal for a different reason than the ones that are the major part of the drug war. The stuff he deals with is more innocuous and therapeutic as marijuana is, which I got to tell you about that. Marijuana is a Schedule I drug at the federal level, meaning it's classified alongside heroin, and it's classified safer than cocaine and methamphetamine. Another example of insanity, because cocaine and methamphetamine are Schedule IIs. Another example of insanity. But sure, he comes in and he sells generic drugs competing against the inappropriately branded stuff that the various pharmaceutical companies are selling at highly inflated prices. And it just shows what free market can do if the government just gets out of the way. You can supply people's needs. But you got to have a lot more of those people supplying people's needs, and the government keeps getting in the way.
Before we talk more about the drug war a little bit later, one more question about generics. If the government actually started allowing more generics to easily get through, and obviously some generics are allowed, but not nearly enough, how much money do you think this would save Americans? How much profits would it take off the bottom line then for these big pharmaceutical companies?
Oh, I don't have any numbers. But we're talking 90% of the, I would guess, 90% of the money that goes into the branded prescription pharmaceuticals would be saved. Now, not 90% of all costs would be saved, but 90% of the money that now goes through the branded processes. Things like EpiPens, which is, it's a 70-year-old drug, at least, epinephrine. It's an ancient drug, and it's pretty easy to deliver in a needle and a syringe. That's how we used to always deliver it. And little kids would carry their Anakit around with them with a needle and a syringe. EpiPen comes along, and, it's not terribly expensive when it first came out, but then over time, for whatever strange reasons, the EpiPen ended up being the only allowable thing, and you can't give the kids Anakits anymore with needles and syringes because, it's too complicated for them now. And then the EpiPen price goes through the roof when FDA prevents others from competing. And that happens all the time. There's drugs for parasites, just simple worms that don't use too much in the United States, but it used to be about $8 a pill, and the child would take one pill and get rid of the worms out of their intestines. And there were two primary ones, mebendazole and albendazole. And then something happens to one of those drugs that I believe was an FDA concept, but it might have been a sneaky thing by the drug company that was making it to pull it off because they thought it might become a cancer drug. But all of a sudden, the albendazole prices went up to $350 per pill. You can get these for one penny in China. And in the United States, they're $350 a pill. These things are just ripe for pharmaceutical arbitrage, but the government puts up all these walls and barriers to preventing people from exchanging things freely. It's one of those. Oh, go ahead.
It definitely, I mean, I'm sure you could go on and on with more stories like this, but it definitely adds to what I think that the healthcare system is broken, and I think it was broken long before Obamacare. And I think, John, you know, whether it's the problems with the drug prices, whether it's the United States heading towards universal healthcare, I think it's getting worse before it gets better.
Oh, yeah. I mean, that's the nature of government. It always keeps getting things worse. I agree with you completely that the system was profoundly broken before Obamacare, and the Republicans who kept on saying we have the best medical system in the world and all that, they had their heads up their butts. And they need to be chastised for thinking we had such a wonderful system. We had a horribly failed crony corporatist system. And what Obamacare did was simply mandate that everybody participate in that fascism. But it was already pretty bad. There's so many ways that we could make things easier. Let's do like a simple one. For example, why do you need to go to a doctor to get a prescription for a cholesterol-lowering drug? Who made that rule? Because it's not there in the rest of the world, but it's here in the United States that you got to go get a prescription. What are they, a priesthood? Or doctor? I'm a doctor, but are we doctors some kind of priesthood that we should be able to be in this position of you've got to go through us to get this? If you eliminated this requirement for prescriptions and you said you can go to your doctor, get their advice, but you don't have to go to your doctor. You can just get the stuff that you know you've been needing. You don't have to go through the rigmarole and pay the guy $300 for a 5-minute prescription refill visit. You can just go get your drugs over the counter. Think what that would do to the prices of pharmaceuticals. Ooh, way, way down. And people aren't dropping from overdosing themselves on cholesterol pills throughout the world. Not at all. You still get the wise advice of your physicians, but you can also get the wise advice of the internet and trusted sources on the internet and all kinds of other things. You shouldn't have to be going to the doctor for these things.
Yeah, I agree. And in a lot of countries, like whether it's Mexico or others, the pharmacist is pretty knowledgeable, but that everything is funneled. I think you mentioned in the book that the American Medical Association has been involved in pushing it this way, but the government before Obamacare, and obviously Obamacare is a huge mess as well, and it's only making things worse. But the government has been involved, according to my research, in the healthcare system, John, since really the Great Depression in 1929, when FDR started putting on wage and price controls there. And so one of the perks for the employers to give employees was health insurance. And so that was a way of getting around those wage and price controls. Was they started giving people health insurance as a perk, and then the government, started ramping up its intervention into the healthcare market since then. Basically misallocating capital and creating new rules and regulations. I think now the hospitals, John, the hospitals now essentially, a lot of them run at a loss, and then the government rebates them a bunch of money at the end of each year. And so now you have, like, I've read stories about this where the hospitals drastically overcharge for things to rip off the government. So they'll, for a syringe or something, instead of charging like $5 or something for a certain amount of syringes, they'll charge the government $1,000, and you have just basically blatant fraud, but the hospital makes a profit this way.
Yeah, and there's all kinds of frauds like that, and most of them end up being against the patients. My own university, the University of Virginia, that I was faculty on for ages, they will charge hundreds of dollars for a $4 blood count, and literally they'll accept $4 from as a wholesale price for a doctor in town to get a blood draw for $3.50 or $4, but they'll charge a patient $275. And if the patient doesn't pay, they'll sue their patient. They'll sue their own patient for not paying this egregiously hyperinflated price. That happens all the time, and it's a side effect of the whole third-party payer scheme that the Democrats and Republicans seem to be so addicted to. The insurance the insurance system. If you think about the insurance system in this country, insurance companies, they are focused on collective outcomes, group outcomes. That's how they make their money. They use data. They take all the data and they figure out, if we group all these people together, we're going to make a profit if we charge such and such amount. That's the nature of insurance. Another nature of insurance is that it's all based on a potential risk, not an actualized risk, but potential risks. So in this country, the politicians have put groupthink insurance companies who, by their nature and for all the existence of insurance, has always thought about the collective outcome. They put the collective thinking insurance companies in charge of one of the most individual concepts we should be having, which is our personal individual health care. And that just can't go well. And it hasn't gone well. And ever since the government started subsidizing health insurance, encouraging health insurance, promoting health insurance, the system has been failing. And you're absolutely right. The government started it, and the best thing the government can do is simply stop subsidizing and promoting health insurance, and then things will start fixing themselves.
I wish that would happen, but I think things are going to get worse before they get better because of how much power the mainstream media has and how misinformed a lot of Americans in general are about free markets and capitalism. One of the things LBJ, I remember LBJ when he got Medicare and Medicaid passed, he said the things would only cost $1 billion at most, and look how much the cost of those has ballooned. But when I go to the doctor's office, John, one thing I've noticed, and I think this has increased more over the years, is that there's the doctor will not even spend 5 minutes on you anymore. You fill out all this paperwork. There's a shortage of doctors and nurses, and the doctor's basically been commoditized. So yes, maybe they make a good living, but they have to see more patients in fewer amount of time. And at the doctor's office, John, it seems that really there's tons and tons of paperwork employees. So there's some of the doctor's offices I've been to, there's literally almost a dozen paperwork employees, 1 or 2 doctors and 1 or 2 nurses.
Yeah, that's pretty standard actually to have that. It's a ridiculous allocation of resources, and there's a way around that. It's just you got to break away from the insurance system and find your way into the free market, which there is free market out there in the form of direct primary care doctors who you pay them a monthly fee and they take care of all your primary care needs, which is 80% of what you need, and then you get into find what's left of catastrophic insurance or a healthcare sharing ministry, some way to get your catastrophic fears protected against, and to negotiate, one of these ministries or insurance companies that does a catastrophic plan can negotiate down the ridiculously hyperinflated prices that you'd otherwise have to be paying as a self-pay patient. But you can find these ways through the free market, but you got to break away from this employer gives me this insurance, I might as well take it. Well, okay, but it's part of your enslavement. And you're stuck going to these doctors who are increasingly despising their jobs, complaining about it because all they do is paperwork, and sitting there staring at their computer, filling out their electronic medical records that they're mandated to use, not even looking at the patient very much. Or if they still have the character to look at their patient, then they've got to go out of the office and spend a whole lot of time clicking things in the electronic medical record, which is almost entirely designed for insurance company claims and to collect data so that they can have better group analysis that does nothing for an individual. It's a difficult system. I agree with you. It's not going to get better until the American population undoes their brainwashing and recognizing that socialism has failed on every experiment known to man, and failed at the horrible cost of human dignity in these horribly large experiments, and starts recognizing that freedom and liberty are the way to go. But is that going to happen? I'm increasingly suspicious it won't.
Yeah, I mean, look, the Republicans are supposed to be for limited government and free markets, and they can't even get rid of Obamacare, repeal and replace. They've had 7 years to try to get rid of it. I think Obamacare, John, is basically just the Supreme Court agreed with me. President Obama said it was not a tax, but it basically is a tax on healthy young adults who pay into the system. So, people with either pre-existing conditions or baby boomers who need who have higher medical bills then can extract from that system. So it seems like a pyramid scheme to me. It's basically a tax or a pyramid scheme. And Dr. Dave Janda, I don't know if you're familiar with his work, he's basically said, the government, whether it's Hillary Clinton or other people in the government, have been planning for this UK single-payer rationing system to come in the near future.
Yeah, I'm sure they are planning, and certainly Bernie Sanders is all in favor of socialism. It's such a strange paradox that a man who claims to be pro-peace uses all the philosophies of war when it comes to his healthcare thinking. And by that I mean that you cannot have a war without somebody initiating force against somebody else. That's the nature of war, is the initiation of force. And he's in favor of peace. I like that part about him. But then on the flip side, he's socialist, and socialism by its nature initiates force against the innocent always, and that is the sine qua non of war. So we've got this totally distorted guy up there with a terribly ideologic schism leading the charge for single payer, and the Democrats are jumping on board like a bunch of sheep. And the Republicans, meanwhile, are looking at something like Obamacare and all the stuff that Obamacare come up with as some kind of, well, it's better than that. And I honestly am not sure. I don't know that the crony corporatist or crony collectivist system that Obamacare created, which is essentially fascist, is any better than socialism. It's just that it's probably more expensive than socialism and has a whole lot of the flaws that socialism has. I'm not in the least bit in favor of going towards socialism, because what that means is that the only way to control costs is for the payer to determine what people are going to have, what medical care they're going to have. It's the only way to control costs in a single payer system. The government's got to control the costs, and that means controlling your choices. And that's not freedom. That's not America. If you want that, go to Sweden. Don't do that to us, and don't force that upon us. But that's what Democrats particularly like to do.
I'm not a fan of Bernie. Sorry. What were you saying, Ed?
Oh, I just said, I've just asked the Democrats to stop using force against their fellow man. But that's not going to happen because they're convinced that it's okay to, because they're so smart, you see.
Yeah, they have 2 or 3 degrees from Harvard or other Ivy League schools. I'm not a fan of Bernie Sanders. I think he's a moron. I mean, he was praising Hugo Chavez for the great job that was being done economically in Venezuela, and look how bad bad a shape Venezuela is in now. They have all those oil assets, and they have food shortages, and people are eating dogs, and people are murdering each other for a bag of flour, or people are murdering each other to get even $5 US for hard currency there.
Yeah.
So it's a total mess. I want to transition now to the drug war. So when I was a little kid going through school, we had the DARE program. The common historical reference is that President Nixon created the drug war, but the drug war has really been going on for a lot longer than that. I believe like decades before that, started with anti-marijuana stuff, anti-marijuana legislation. Why do you think the drug war has failed?
The same reason that prohibition failed. People want these things, and you can make them illegal, but that doesn't make them immoral. It doesn't make them wrong. And so when people want something, they'll find a way to get those things. And if you make it illegal, then you draw the criminally minded people into that sector of the economy. And that's where you get the wars, the drug wars, the battles, the gunfights, is the criminalization of something that is just a mutually determined thing to do, which is one person selling drugs to another. Now, there's all kinds of complexities here. There's no way in heck I'm going to say heroin is something that would be in the least bit smart to take. I think it's stupid to take it. It's well known, very clearly a very bad substance that replaces your family, replaces everything you love. It causes destruction and death wherever it goes. And but taking it voluntarily is what heroin addicts initially do. and then they continue it, quote, voluntarily. It's not being forced upon them by another human being. It's being forced upon them by nature and biology when they have to keep on taking it. It's a horrible drug. But making it illegal has done nothing to prevent the use of it, has criminalized people who are actually sick or misled, turn them into criminals, put them in jail. It costs tons of money. It's triggered wars. It's a horrible concept to illegalize people's choices.
Do you think Portugal has done the right thing with decriminalizing so many of the drugs, or do you think there should be another way then to allow people who want to use the drugs, but maybe just teach them proper education where they shouldn't, like what you said about heroin?
Yeah, I'm a combination. I think that decriminalizing or legalizing, bringing them into normal free trade and let the system work its way out. There's going to be people who are going to use drugs. There's going to be people who make mistakes, people who get addicted. The companies that supply drugs like heroin should have their butts sued repeatedly until they realize that, gee, I shouldn't be making this stuff because every time we give it to somebody, they have a tendency to get addicted or die, and it's a negligent product in the first place. Let the civil courts deal with this stuff. But yeah, it shouldn't be criminal. These are addicts. They are people with diseases caused by some bad choices that they made at the beginning, no doubt. But treating them as criminals really causes nothing but harm for everybody, and it will end up the way, and it has ended up the way prohibition ended, which is just lots of unnecessary violence. It's what the Silk Road was built for, to allow this sector of the market to function without violence, and the government couldn't tolerate that, so they nailed the Silk Road.
Yeah, and unlike the alcohol prohibition, we have these overcrowded U.S. prisons where a lot of people for totally nonviolent crimes, just drug offenses, are in there rotting away in prison. Do you think this private for prison complex has really metastasized the size of the people going to jail for drug crimes? Then there's the economic incentive now for the judge to put the person in prison because the prison's going to make money off the drug criminal in quotes.
Yeah, I wouldn't be surprised if that's an influence, one of the many influences. It may also be that the privatization of the prisons is just a necessary part of providing enough supply of prisons to make up for the demand caused by the drug war. And the government just realized that they're too incompetent to provide enough prisons to imprison all the people that they incompetently arrested as part of the incompetent drug war. It's a toughie. I have a good friend who's a retired DEA agent, although he's international anti-narco terrorist, different kind of game. But my friend thinks that most of these drugs should be legal, and that the drug war, for the most part, he's not as far on this as I am, but for the most part should be stopped because it's not very effective. And it's really anti-freedom. If people want to inject nasty stuff into their bodies, if it's not harming anybody else, well, why do we feel the need to tell them not to?
And John, the drug war is also the drug war that the U.S. puts on is also hypocritical because, I mean, look at whether it's what Gary Webb unveiled or the Contra incidents of them. The CIA has been dealing drugs. So here we have, all these agencies, right, trying to bust down drug cartels. We have fairly accurate, TV shows now showing the CIA dealing drugs on TVs and movies. But, they're exempt from the drug war. So, they're busting up cartels. But, the largest cartel now dealing drugs might be the CIA.
It could be. It could be. I don't have any particular insights into that other than to have a general recognition that government generally considers itself above the law. And the more it behaves fascist, the more it behaves thinking that it has the right to do anything it thinks is necessary, which is this fantastic definition of fascism. the more likely they're going to do these things. I mean, look at the state governments. It's illegal to have lotteries except for the government of the states. They can have lotteries, but nobody else is allowed to have lotteries in most states.
Well, that's how poor people pay taxes, right? The lottery, when the state has a lottery, that's how you get the poor people to pay taxes.
That's one way. It's also definitely a tax on people who can't do math.
Yep. Yeah, because the odds of playing the lottery, actually, the more people who play, the lower the odds go down. The odds go down, actually, the more people who play. But did you see any of the new Mises Institute podcasts on the history of drug war in the U.S.? There's the new historical controversies with Chris Calton. I've been catching up on those as background research for this interview the last week or two. He's been releasing 1 or 2 new podcasts a week for the last month.
Oh, I didn't know about them, and I should. I'll have to keep my eye out for that, for sure. I'll go digging in.
Yeah, I'll attach a link for the listeners to check that out, a couple of those in the info section of this interview. But John, if our listeners want to research the problems with the healthcare system, maybe some solutions, are there any websites or books that people should do research on that would really help them, that you think are some of the best at this?
Well, I'll plug one of my books, which is Assume the Physician. That's the story of a young doctor who has to go. It's a fiction story, but goes through his first year of postgraduate training, and it's very funny. The whole thing is funny, but it presents the medical system as it really is. So Assume the Physician, and you will learn a whole lot about the medical system and the pharmaceutical government complex, all while laughing all the way through. So that would be a good thing. It plugs my own book. Reading Drug Lord that I wrote with Doug Casey is also a great way to learn about a lot of this, about the drug war and the so-called legal pharmaceutical business, which I am quite convinced, having been in it, that it's relatively immoral compared to the illegal drug business, which is much more moral. At least it's all. The illegal drug business is based on voluntary exchange, and it's done in a free market mostly. The legal drug business is just riddled with manipulations and government schemes. So you can look into the Free Market Medical Association. The Association of American Physicians and Surgeons has a lot to say about this. Organization called Docs for Patient Care. The 4 is the number 4, so Docs, number 4, Patient Care. These are all organizations that are pushing free market solutions and teach about all the problems in the current healthcare system, which all derive from this fascist, crony, collectivist type of system that we've had for so long.
I completely agree. There's so much fraud. There's so much fraud, corruption, and hypocrisy in the healthcare system, and it's such an important system. Other than the energy industry, it's one of the 2 largest real industries out there. Obviously not counting the banks and central banks that push pieces of paper back and forth in trading. This is an important real world industry that has been basically, I think, totally corrupted and almost destroyed.
Yeah, and there's some simple things that we don't have to wait for government to do, but how do you get the doctors to do them? So right now, the prices are out of control. The prices are shooting up. That doesn't mean the costs are shooting up. The prices are shooting up. The list prices, if you can ever get the list price out of a facility, it might be 10 times what the facility is willing to accept in payment. 10 times. So it's something that they're happy to accept $100 in payment for, they're billing you $1,000 for. And that's why that hyperinflation of the prices that the hospitals and the doctors are doing gives justification for the insurance companies to be an intermediary. The insurance companies say, well, we negotiate those prices down for you. And so we'll get those prices down to $100, and the doctors will take it from us, but you can't do that if you don't have insurance. So the insurance companies love the high prices because it gives justification for their product, and it allows them to go to the politicians and say, you've got to make sure everyone has our product. The doctors raise their prices, or the facilities raise their prices so they can make more money. The patient doesn't care because someone else is paying. So you've got a situation where the prices are determined by the doctor facility who wants higher prices, the patient who doesn't care, and an insurance company who wants higher prices. And when you have that situation, you're going to get higher prices and higher prices and higher prices. And it spirals up into a disaster. The solution the doctors can do is just stop allowing their admin weenies to charge incorrect, hyperinflated prices. Put their prices out on the internet and say, this is what we charge for a CBC. And across the street, that guy charges $2 more, so we're cheaper. Come on over to us. CBC being a complete blood count.
The only place I know that publishes their prices is that Free Market Surgery Center in Oklahoma City. That's the only one I've heard of.
There's more now. Yeah, Keith Smith at Oklahoma Surgical Center started doing that, and it's great. Monticello Surgical Center in Charlottesville, Virginia does that, and there's an increasing number of them that are following suit with transparent pricing. The direct primary care doctors, there's probably 3,000 of them in the United States now. They put their prices online, so it's increasing. And that price transparency, this is what you pay. It's like car whatever. That can't remember which one of those used car dealerships does it, but put your price. This is the price you pay, and it's not going to be tricky, and there's no added things. It may be 2% of the medical economy right now. It needs to be 90% or more, but it's really under the doctor's control for the most part. And if they just recognize that and say, I will set honest and fair prices for what I do. But they're fearful because then they think the insurance companies are going to only pay them half or a quarter of what they set, which isn't the case at all. The insurance companies are going to pay them the same amount because the insurance companies basically set their own prices for what they're going to pay, and they don't pay much heed to what the doctor is charging. But it's hard to get the doctors to do that. They generally blow off their steam by just getting mad.
And John, most doctors are hardcore Democrats now because they've been brainwashed into believing the system. So a lot of them are in favor of Obamacare. I see, them writing articles. So a lot of them are politicized now too, as well.
It happens. Yeah, I saw maybe about 5 years ago. I saw a poll, pretty large poll of physicians that showed that 40% declared themselves socially liberal and economically conservative, which might be a libertarian bent, but they're not really aware of their libertarianness. I think the young doctors, if they're not fairly socialist or Democrat, the new ones coming up, they're going to find themselves fairly unhappy very rapidly in the medical system. Libertarians don't do well as physicians in the medical system because it's just libertarians are the anti-fascists, the true Antifas. The libertarians are opposed to the true fascism, and the medical system, unfortunately, is kind of the front lines of fascism. So libertarians just don't want to stay in the field, which is too bad.
And in addition to that, who can blame them with the student loan debt now, the crushing student loan debt you have to take on to even be a doctor, or not even just a regular doctor, a specialist is even more than that, considering all the extra time you have to spend with fellowships and et cetera.
Oh, sure. It's incredibly expensive, and all the loan money that you can get makes the tuition prices go up and up. That's, of course, why college tuition keeps going up, is all the unsecured loan money that's available for it. The money just flows into it, and the prices go up. And then you need more loan money, which makes the prices go up. And around that cycle goes. So it's true for college, true for medical school. It's all part of a maybe unintentional, who knows, for some people who are really smart, like the top people at the top of some of these banks, maybe it's very intentional as part of a process of indentured servitude of the masses. But for most, it's just incompetence of government programs that ends up enslaving us.
Yep, and we became debt serfs. And once you have, that student loan debt, you can't discharge it in bankruptcy. So then you're kind of basically a slave to the system. Then you gotta keep working every day to pay off the debt. So especially with $200,000 or more of medical school debt, it would just be mind-boggling amount of debt.
Oh yeah, and when Obamacare, they basically federalized undergraduate college debt. It did so, it kind of stuck it there in the Obamacare law. What it has to do with Obamacare, who the heck knows? But But basically, it becomes the federal government will have a choice that it can offer to excuse you from your debt if you'll just come work for the government for a while. And basically, it prints up money. It prints up money, fake money, takes no work to make it, to pay for your school. You have to pay it back with real work, or you can give them your life and work for the government. So the government gets increasing number of people who are going to be willing to be debt slaves. And that talks about the power of the Federal Reserve and the fiat, baloney fiat U.S. dollar.
Or the government has bought their loyalty then, because I don't like Upton Sinclair. I think he's a communist, but he did say you can't trust a man who to see the truth if his paycheck is relying on not seeing the truth. So I live right outside of Washington D.C. since the year 2000, and I've seen a lot of these types move here over the years.
Yeah. Yep. There's a lot of those types, and Washington is going to be, probably the place that survives the recession the best. Just keeps on crowding more and more money, pulling more and more money to it. That's the nature of a declining empire.
Well, John, I enjoyed our discussion a lot about the healthcare industry. It'll be very interesting to see how President Trump and or the Republican Congress continues to make things worse.
Government doesn't make things better, so it doesn't matter which party's there, they'll make it worse.
They might find the one statistic out of 1,000 that makes it look better, but I think, we're basically like 15th century medicine where the cure is worse than the disease.
Yeah, that may be the case. It's certainly the people who broke the system you can't count on to fix it. So I just encourage your listeners to get out of the government system as much as they possibly can. Find the free market, and because it's there, you got to go looking, find it, escape the insurance handcuffs, and find your way out of it.
Excuse me?
As fast as you can. Get your way out of it.
Yeah, but before universal health care comes to the United States, because it's not that far away. I mean, if the Republicans lose a bunch of seats in Congress to the Democrats, we could be knocking on universal health care in the near future.
Yeah, but and actually, one of the things we can start doing, the language is really used as a tool. That's why Doug and I write fiction, too, is language can be a tool. And the phrase universal health care, for example, is a common used phrase. But it's not really health care, is it? It's really medical care. Health doesn't cost any money. Health is what you do. Health care is what you do to maintain your health. It's exercise and stress avoidance and appropriate nutrition. All the things that you can make your own choices. That preserves your health. That's your health care. Medical care is what you need from other people when your health has failed despite all your best efforts. And
yeah, that's correct. That's like in the past where they labeled something the Patriot Act and it had nothing to do with patriotism. So that's like just a clever government ploy. Yeah, if you wanted to be factual about labeling the healthcare system, it would be like higher cost, inflated, as you said, or hyperinflated health rationing system or something.
Yeah, or something like hyperinflated hyperinflated sick care system. That might be better. We have a sick care system, not a health care system. And, and the words have been perverted. So we should not use the words that the Democrats tend to choose, like, anything positive about their government-controlled, mandated, brilliant, narcissistic pile of crap. We should use words like pile of crap system that the Democrats want. Come up with something more intelligent than pile of crap. But socialist, I think, is appropriate. Socialist, government-controlled medical care, government-mandated financial controls, whatever, something like that, to say what it really is. Because it's not universal health care. It's not even universal medical care. It's government-controlled medical care.
Yeah, and if things progress to full rationing, the government's going to decide who lives or dies. Look at that case. I don't know if you saw that last month, but look at the case in England where the parents were trying to take
Yeah.
this little baby to the United States for a Hail Mary experimental drug, and the British government denied the parents' request to do it. Right?
It's amazing. Yeah, they're paying for it themselves and through donations, and the government prevented them from leaving. Yeah, it's an example, and it's cherry picked, but there's a whole lot of other more subtle ones that happen in the UK, and there's a whole lot of subtle ones that happen in our own system, because there is effectively the prices are so high that people fear bankruptcy from even going to a regular doctor's appointment now. And so our current system sucks. The Obamacare mandated that you participate in this horrible fascist system. And that's really horrific that the Democrats could be behind this mandated fascism. And what we really need is to pull back, not just eliminate Obamacare, but open up the free markets. Let the free markets thrive and get out of their way. And then let people be charitable. If there's 82 million people who voted for Obama, let them all socialize themselves. But don't force it on us. Let them provide insurance for everybody who wants insurance. Let them do that. There's nothing to do with us.
Amen. And Obamacare was basically a tax. I mean, so even if you wanted out of the system, you still had to pay them. So because the government needs the revenue now, because the government is basically broke and printing money just to delay a collapse. But I want to thank you for your time today, John. And I'll definitely attach links for our listeners to go out there and buy both of your excellent fictional books in the High Ground series, first book was Speculator, about African gold mining and follows the story of 23-year-old Charles Knight. Second book follows 30-year-old Charles Knight 7 years later, and it's called Drug Lord. And I wait with anticipation your third book, which is supposed to be out next year, right, called Assassin?
Correct. And he'll be just a little bit older. Charles is maybe a year older or so in that book. But he learned a lot.
Wall Street for Main Street needs your help. Since the middle of 2016, YouTube continues to increasingly censor and sabotage the growth and success of my channel with dramatically slower or no subscriber growth, a huge decrease in views per month compared to 2016, and well over $10,000 lost in Google AdSense revenues the last 18 months. I should have been way over 20,000 subscribers and way over 3 million views last year, but it feels like I am Sisyphus trying to roll a heavier boulder with more and more additional weight up a steeper and steeper hill. In the last few weeks, all of my videos have been set to demonetization by default, and I have to manually protest each video. This is in addition to even lower than usual Google AdSense revenues after the adpocalypse started over a year ago for me. This has also affected my ability to get paid advertisers to agree to deals not involving YouTube, as I lost $3,000 per month in paid advertising deals at the end of June 2017 because all my analytics are down a lot thanks to YouTube censorship algorithms that have intentionally kneecapped the growth of my channel. With YouTube /Google/Alphabet /Don't Be Evil strongly considering demonetizing or setting all libertarian, conservative, or pro-Trump content to private to prevent any sharing or monetization, it is imperative I have a contingency plan to figure out how to make a living off my content. Each 30 to 40 minute video takes a few hours of my time before it's released to the public. There's a strong possibility that in the near future, YouTube will force me to move all or almost all my content to a new video upload website that allows free speech or behind a paywall on my own website. Thanks if you have already made a one-time or recurring monthly donation, and thanks in advance for any future donations as I decide the future of my channel and what to do with my content going forward. We accept one-time donations on the Wall Street for Main Street website via PayPal, Bitcoin, or Gold Money. You can also become a monthly Patreon contributor for $1 or more a month if you want to help me out. And don't forget to like each video on YouTube and share it with your friends and family if you think they would like the content.